Welcome to our broadcast, The Path to Be Well, Knowledge and Learning session. Joining me today is my colleague Paul, and our topic will be focused on inhalation as one method of consuming cannabis. You won't want to miss it, so please do stay tuned. To all of our listeners, we're so happy that you've joined us today. Note that you can also subscribe on our YouTube channel or find us on weedwell.live. Now, these sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you. And we'll bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do them and us a favor by sharing this event. My name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. Then as a teenager, I did sample marijuana and quickly concluded that it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open, my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. And determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So as I said, joining me today is Paul. Paul, welcome. Good to see you again.
Nice to see you, Mark. And how's that for timing? For those of you listening and viewing in Ontario, we just got notice of our stay-at-home order that came through. We could hear in the background there. But in any event, I'll just say hopefully everyone is staying safe during this time.
That's right, Paul.
So as you introduced, inhalation will be our discussion today. And just before we get into that, I'll break down our manifesto and what Be Informed is about. And it'll tie into a little story that Mark will share in just a moment here. The manifesto today is, I know my body and what works, what doesn't work, and I have a clear path of where I want to go. Be Informed is all about, I've reviewed the 4 ways to consume and completed the consumption component of my treatment plan. Previously, we have done design your own treatment plan, and that's the ultimate goal in Be Informed. And so this will lead us into a discussion, and hopefully, Mark, you can share with us about Francis. And Francis was found in episode number 10. In our podcast, which you can find at podcast.weedwell.com. Mark, can you share a little bit of how that ties in with Francis?
Yes, absolutely, Paul. Francis, every story, there's something that really stands out. With Francis specifically, he was sharing how debilitating his migraines were. The scenarios where confined pretty much to a dark room and really having difficulty functioning with those. So for him, his treatment plan was really to prevent the migraine from really manifesting itself to the fullest. And what he have found that is working best for him, and today as well, is inhalation. mostly in the way of vaporizing. And why that is, and I'm sure you'll get into this a little bit more, is because it's quick acting. And people tell us that those that suffer from migraines, they sense it coming on in their body in one form or another, and that form might be different from patient to patient, but they just tend to know. So if they're able to medicate early on before the manifestation or the onset of the migraine, they can at times prevent it or really reduce it significantly. Paul, to you.
Okay, so inhalation in and of itself is a method of consumption where you're going to get the cannabis medicine in through your lungs. And the basic pathway it would take is you're inhaling through your mouth down into your lungs. There's a good blood flow in your lungs. The blood flow from the lungs take the cannabis medicine and transport it through the body via bloodstream to the brain, to the different body parts that utilize the cannabis. And so any method that uses an inhalation is what we're talking about today. And really we have two categories, and we even subdivide further. And I know you've touched on this during the week to some degree, Mark. And the traditional method, or the best known method, if you will, is smoking, and that's kind of one category. And then we have the separate category of vaporizing, and this is where we begin to see subcategories, if you will. And this is an evolution over time, even since I've been, we'll say, in the industry. But you could share more of the changes from that. And we go from a dry vaporizer, or what we call more, or we would see as more a traditional vaporizer, to now we're vaporizing concentrates, liquids, if you will, in much higher concentration. And that's the subdivision of vaporizer. So whether it's a dry cannabis versus a concentrate. But Mark, when you started, and you share with us all the time, 8 years ago now in the industry, the consumer has changed drastically over time. Is it fair to say the majority of people came in and they were smoking?
By far, Paul, for sure. Many had been self-medicating. Those people that I judged previously had been self-medicating. And with the exception of bongs and pipes, for the most part, by far, was rolling their joint and smoking it that way. And, they claimed that it was working well for them. So whenever I found myself sitting across, someone and introducing the concept of vaporizing, I will say for many, there was tremendous resistance. Smoking that joint is something that they had become reliant on, really, because that was their medication. And now someone's going to say, yeah, okay, but maybe you need to consider something else. There was a high degree of reluctance. So it was an educational process, Paul, where we had to talk about the efficiency of smoking a joint, which is not very efficient. Some numbers run in about 20 or 80% of the valuable cannabinoids literally go up in smoke, versus vaporizing, where that's reduced to maybe 10 or 15%, that is lost to vapor that you're not consuming. So by far, the vaporizer was far more efficient in extracting the valuable cannabinoids from the cannabis. So with that concept in mind, some of them were a little bit more open. Those of them who did go that way, and many did, if not most, would come back and says, you know what, it is different, and it is a transition. No different than, if you're used to drinking coffee with sweeteners and cream, and you know that you should be dropping the sweeteners, it's not an easy thing to do. I can attest to that. I'm still fighting that battle. But they did say that it was a transition. And, what they were so familiar with and accustomed to, now they had to change. And I was always quick to say, it doesn't mean to say you don't smoke your joint. If you find that it's therapeutic to roll a joint and go through that process and smoke that joint, by all means, that could be, your nightcap, or when you get home from work, if you like, as an example. We're not saying don't do it, but try to transition more towards that for the reasons we've already talked about. And I would say the majority who have tried it would come back and say it was a transition. Um, it is better. It's working better. I'm getting more value out of it. I'm actually consuming less cannabis for the reasons that we've talked about as well. And many have actually said I would never go back to smoking a joint. For that, it doesn't mean that they're not smoking at all, but as their regular go-to, if you like. And some of them made comments about, I live in an apartment building. Smoking a joint was really not pleasurable for those in around me. It wasn't discreet that way. When you're consuming dry cannabis via a vaporizer, there's still an odor, but it's more organic, if you like. It doesn't have that really distinctive skunky smell of smoking cannabis. So, Paul, I'm sure you're hearing a lot more than you thought you would, but I didn't realize it until I started talking about it. But here we are. Back to you.
Yes, and that's fine. That's the evolution of things. And, at the start, there was only so many methods of consumption available. And even when I started. And so it becomes a more discerning client or consumer of cannabis, because now the questions, or over time, where you're introducing those concepts to the consumers, they're now asking us, what can I do because I have emphysema? And I know you covered this in your Be Clear discussion. What can I do because I gave up smoking? I don't want that motion because it's just going to bring back that memory, that muscle memory, and I might be tempted again to continue smoking. And so that consumer now is bringing those questions to us, and it's great. And so what I would say right away is it appears there's a greater safety factor in consuming cannabis via I'm having a little bit of an issue today. By vaporization, thank you. We're going to struggle through this together, though, Mark.
Yeah.
It may be safer, at least what we know right now, but there are no long-term studies to this. And so as more information comes along, whether it's good, bad, or ugly, we will share that with our consumers and our audience here as things are figured out. We'll touch on a little bit of the vape issues towards the end, specific to what happened a couple of years ago, but we'll just leave that alone for now. So we'll just leave smoking at that. It's the bong, the pipe, all the methods that you talked about, whether it's rolling a joint and you would inhale it, and that would be the most traditional method that we know.
Paul, if I can just jump in here, because I see you're struggling a little bit with breath as a result of your cold and whatnot. So, grab a glass or a sip of water. But, the bong, my understanding was kind of maybe in a direction of a vaporizer. What I mean by that, you're still igniting it, so that component is still very much the same, but it would be filtered through typically water in the bong to remove the harshness, if you like, of the smoke and cool it down, so easier on the throat and potentially the lungs. So that's my only comparison to vaporizing, is that it's easier to intake or inhale for that reason.
Yeah, and I think you touched on it in that little description there. It's still burning it, and there's your difference. The actual burn substance, whatever method you're using, versus a substance that's heated enough to just be release the cannabinoids into a vapor. And so we'll focus a little bit more on there, because there's now many more different methods of consumption inside that vaporization category. And so the traditional one that I mentioned on the outset would be you're vaporizing a dry flower. And so typically those devices, the vaporizers themselves, come in two forms. One would be your desktop, your bedside table, and they're typically not to be moved. And so you talked about the nightcap, or someone maybe medicating before they go to sleep and they want to take a quick acting cannabis medicine. That would be an inhalation, and a desktop would be perfectly appropriate for that. The other way that the vaporizer come is more in a handheld, and some of them literally are hand sized. And they tend to come with, well, they don't tend to come, they come with glass chambers usually, that can be filled and placed on the heater, where it's heated high enough temperature, usually around 195, 205 degrees Celsius, where it releases into a vapor. And those are very handy because those glass chambers can be pre-filled, and so you can use them when you want, if you want to dose and medicate on the go, as well as the handheld part, or the heater part, if you will, allows you to carry it on the go and dose on the go. And so really it's something you would, the two dry vaporizers is something you would leave at home, and something you would dose on the go, are your two choices. Anything to add there, Mark?
Yeah, actually, a couple of small
Yep.
points. One of them is the desktop. As you said, not so portable. It doesn't mean you can't move it from your night table to the kitchen table, but certainly not something that you would be taking with you in your car, or just going somewhere. But to make it a little more flexible and adaptable, some of them actually come with a bag that you inflate, and then you can take that bag and go sit on your back deck, for example. The beauty of that is that uh, it is vaporized, but then contained in that bag, so you can prolong, your dosing, so not being driven by the fact that it's being vaporized and you need to intake it. Otherwise, it's going to go into the atmosphere. So that's a nice little feature from the stationary unit with a bag. The other thing I will say is that, and probably no longer today, don't know for sure, but the earlier vaporizers, or the handheld devices, some of them did not really have very good control of temperature. So they kind of had, okay, this is kind of the optimum, and that's what we're going to use. But for some dry flower, depending on its dryness, depending on many variables, the strain and whatnot, it would not be as efficient. And then they came up with different methods through evolution of controlling that temperature, to the point where they became very, very specific from a digital format. Like, you could change this from 1 degree or half a degree to get the optimum temperature for whatever it is that you're consuming, for the best experience, but also, I believe, for the best extraction of all the valuable cannabinoids in the cannabis dry flower.
For sure. And you know what we've talked with consumers over time is the temperature guideline. It's great with numerical, and you see that as you're doing it, but your instant feedback afterwards is, what does the cannabis look like after consumed? And it gives you a sense that the temperature was too low if you still have the green spots in it, if you will. And if you have more a darker, almost charred look, it tells you that the temperature is too high. And so, correct me if I'm wrong, Mark, you're looking for a tanny, light browny,
That's
um,
right.
uh,
Yeah.
yep, substance left over in your little glass filling chamber.
Hmm.
It kind of tells you you're in the sweet spot as far as temperature goes.
Exactly, Paul.
Okay. So that is, the long and the short of vaporizers, whether it's desktop or handheld or portable, as we would say, and the use with dry cannabis. And so with the dry cannabis, you tend to see, we'll use THC concentrations of up to maybe 30%. And it kind of taps out there. And what we're seeing now, Some places a lot longer than say in Ontario where we're at, or Canada where we're at, is the vaporization of concentrates. And the big difference here is liquid form and much higher concentrations. We're using THC as an example. You'll see percentages in around 70, 80, even upwards of 90%. And so the idea here is very, very small dosing, puffs, if you will, over can be lengthened over time. And so if you picture inhaling a dry cannabis, you might get some longer relief from that. With the more potent stuff, you'll get short-term relief, but you can dose many times during the day, and it's always as needed. These are very small devices generally as well, and they're of the portable nature as well. And so the dosing, if you've heard the term microdosing, this is kind of what we're talking about here. High potency, short-lived, dose through the day.
Yeah. So, Paul, in the unlikely but possibility that someone has joined in late or is a little confused because we're talking about vaporizing, and I know over the last few years there's been some negative press, call it, about vaporizing. That is typically around the vaporizers that are a substitute for smoking a cigarette. And I don't know much about that, only knowing that apparently there are some chemicals, and that's as far as I'm going to go with that. But it really received negative reviews from that perspective. So the vaporizers that we're talking about here are strictly for cannabis use. They are medical devices, so not to be associated with other vaporizers that are, readily available pretty much anywhere.
Yeah. And, that was the point we were going to touch on later. And now is as appropriate time as ever. Thanks for that lead in. And the vaporizers in question tended to be of illegal or gray market sources. We've always talked about in our discussions safe sourcing, government regulated, third party tested of what's in the cannabis that you're going to inhale, drop under your tongue, however you're using it. And so you have verification, oversight, and all these things that lead to what's in the product is supposed to be in the product. And long and short of it is the vitamin E acetate was the issue in these cases where people actually did die. And so if you hear of something called the vape crisis, or you're a little bit of this is what it was, and it was unregulated sources or less than regulated sources, which found this substance, which is not good for the lungs, and it caused major lung issues. And so that's, a very, 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 very short description of the vape crisis, but that's what happened there. The methods that we're talking about, as you mentioned, we're talking about the government regulated or third party tested substances, and know where you're getting your cannabis from. However, if you're vaping the dry, vaping the concentrates or whatever, go back to that and be safe. It's something you're putting in your body. It's something that will have effect on your body. Make sure it's the positive effect that you're looking for, the medication. And so thank you for that lead in to that. So it's interesting as we're seeing consumers in our area over time, more and more are at least inquiring. And I think it's the same idea as when we saw the people first inquiring about smoking to vaporizing, that changed. And now we're seeing more inquiries to the vaporizing of the concentrates and the higher concentration stuff. And it is interesting. And I think there's some want to try it in there and see how it would fit into the treatment plan. And we talk about that as trial and error and listening to your body and titration. These are all things we've talked about before. But understand, if you have something working for you, we'll say in a lower concentration, the dry cannabis, and you're not suffering any ill effects or whatever, it might not necessarily be appropriate for you. I would say it's certainly not appropriate for the novice user or new user. Someone trying to figure out their right dose, their right therapeutic effect, and stuff like that. Because the high concentrations can be subject to increased dependence and increased misuse, and stuff like that. Does that mean, well, I use this, I'm going to have that happen? No, but it is a factor that you're now bringing into taking your medicine. And it's something you need to be aware of and cognizant of. And that's why we mention it here. And so, if something's working for you and there's no need to change it, maybe it's something to leave well enough alone. The only analogy that I could come up with regards to these products is the little cup of detergent that you're supposed to put in your wash. You know, if to the first line is working and you have nice clean clothes and good smelling clothes, it doesn't make sense to put two more cups in to make it more clean. You can't get more clean than clean, right? And so if something's working, maybe leave well enough alone. When I first started this description, some people just want to try it, and that's okay. And you can see how that will work into your treatment plan. But I would really, really caution the novice user. The vape pens, because of the high concentration and whatnot, it's not something you want to start with. It's something you would work towards if that's something that's going to fit in your treatment plan.
Yeah, the concept of a fairly young driver just receiving their driver's license, the Ferrari is probably not the best car to start with.
I like that analogy as well. So whether you go to inhaling as a smoke or any of those methods that we talked about, inhaling through vaporizer or dry product or concentrate, all three can fit into a treatment plan. And generally, the reason they fit so well is as in Francis's story, instant feedback. And anyone medicating with any type of medication, not just cannabis, there's something I think to be said for, I take this now and this happened, and it becomes measurable. It's linked in the brain. And so in Francis's case, if it's a migraine that's coming on that just got stopped in his track, fantastic. That's a definite cause and effect, and people work off that. Whereas, and there's nothing wrong with this, the longer acting stuff, it's harder to do the cause and effect. And when I say longer acting stuff, it would be dosing underneath the tongue or edibles and stuff like that. And for those, we tend to see people that keep symptoms in check, we'll say. And so the anxiety is kept in check, or the pain is kept in check. Where the inhalation works for these two types of patients is when the anxiety is no longer in check anymore, and you want to knock it down, or the pain is no longer in check, it's a little too high and you want to knock it down. And the reality is inhalation is a very good tool in your toolbox, insofar as getting cannabis into your body and acting quickly. And it can be used in conjunction with something that is used over a longer period of time, like dosing underneath the tongue or eating your medicine as in edibles.
Mm-hmm.
And I got to take a break
Yeah,
here.
for sure. I'll go for it. I could see that coming. To add to that, then you've given some good examples. One that I use this week is you've forgotten to take your anxiety medication, whether that's oil under the tongue or otherwise. And, something happens early in your day, and the only way you can cope with it is to reach for, some form of inhalation method, whatever that is, to at least get you in a position where, you're going to see the effect, calm yourself down, and then take your regular, dosing of oils or other types of medication. So it could be a rescue aid in a situation that I just described as well.
For sure. And, Mark, I'll set you up for this one because I know it's you set me up nicely for one. I know it's your discussion tomorrow, but do you want to, touch on a little bit of your titration insofar as inhalation goes and how that might look?
Well, as you said, we always suggest start low and go slow, and it's that's the same for every type of consumption of cannabis. When it comes to inhalation, start with one draw and give it a little bit of time and see how your body responds. Because you might, chances are you'll see something, you'll feel something happening within a minute or two in many cases, and then draw again. So it's always start low, go slow, listen to your body. We say that all the time. We can't say enough about that because your body's going to tell you, where you're at. It's going to turn on the yellow light and say, you may want to slow down a little bit because if you continue, it's going to turn into a red light, so to speak. And then based on that, and Francis was a good example of that, as we talked about already. Then you start looking looking at how many times a day or sessions per day, and then how many puffs or draws per each session. And the clients will get to know that over time. And often it doesn't take a whole lot of time, depending on many variables, of course, but they will get to know that. And I can't say enough about listen to your body for sure, Paul. But we'll give our audience, our listeners, more on this tomorrow.
For sure. The last thing that I would say is we talked about its onset or when the medicine starts working as being very instantaneous, and the feedback is great that way. It is also the method of consumption that is going to last the shortest length of time, and you start to see peak concentrations dropping. Within an hour or two, and then we tend to see this lasting 3 or 4 hours. Of course, we say this as an average, and it's person dependent. And how much you're consuming. Are you consuming other substances with it? There's a lot of factors there, but in general, that's you start to see the peak concentration or your peak dose drop pretty rapidly after an hour or two.
Mm-hmm. Paul, for our listeners, there's been a lot of information shared from smoking to dry cannabis to extracts in a vaporizer, the bongs, and all of that. Could you kind of summarize those again, and 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 put some emphasis on the pros and the cons of each of those methods that would be, I believe, a great value for our listeners.
Okay, so in summary or in general, inhalation is any method where you breathe in the cannabis smoke or vapor, and you'll utilize the lungs and the good blood flow in the lungs to get the cannabis through the body. Now that is broken up, or we break it up into smoking, where it's a substance that's actually burned or lit on fire, and that's your bong, that's your joint, that's your pipe, and any method where you're actually taking the lighter out and burning the substance, and so that's one inhalation method. The other inhalation method is vaporization. And this is where we kind of get our subtypes, if you will. And you can vaporize dry cannabis in what we would call the traditional vaporizer, whether it's a desktop, a big desktop, or a portable handheld one. And they tend to be of lower concentrations when we're talking specifically of THC. They tend to be lower concentrations up to about 30%. The other vaporization method is now that's more readily available and newer, if you will, is the vaporization of the concentrates. And the vaporization of the concentrates are going to have the higher doses of THC. So that's in a nutshell. When you smoke, regardless if you smoke or vaporize, I should say, one of the pros is the instantaneous feedback, the quick onset of action, and we've used the term, we've discussed this, in terms of migraines. In the case of Francis, I've talked about pain or anxiety and how that would fit in as well. And so you get instantaneous feedback to get that pain in check, to get the anxiety in check, and it's shorter lived. And so that can be a pro for some people. Certainly, when we're talking about the extracts and doing the microdosing, that instantaneous feedback and quick high potency dose allows you to dose a little different during the day. And so you can get small, we'll say small shots, if you will, during the day. And that can definitely be a pro in that manner. One of the cons, certainly, to smoking, and you talked about this in the context of an apartment building and whatnot, but I would say just your neighbors in general, is the odor. The odor associated with it is obvious, and I would say most people around can put their finger on something's up there. Now, that may bother you, that may not. Some people come with certain biases. Some people want to hide what they're doing, and you might be anywhere on that spectrum. But if you're worried about what that might appear to your neighbors, then smoking might not be for you, and you would gravitate more towards a vape method, one or the other. With regards to the vaporizers specifically, your desktop allows you to really do it at home only. But your handheld ones or your vape liquids, concentrates, allows you to vape on the go. And so you can adjust accordingly based on your life. If you're at home most of the time, then maybe the desktop is the way to go with the bag that you described. If you know you want to dose on the go and you're on the train each day and need to get through the train ride or what have you, and you know you want to dose on the go, then certainly a portable is a much more effective method. With regards to smoking, we know that there's issues with burning substances and inhaling carcinogens and whatnot, the other substances other than the cannabinoids, and lung health, especially with people in pre-existing conditions. We talk emphysema and stuff like that. With vaporizing, we think it's a better method of consumption from that point of view, lung health, but we cannot say with certainty the long-term health effects to that. So just so we're aware, we're not saying it is. It looks like it, but be aware and always, and we will share with you different things that come out over time as time passes and more people vape, and you can do more long-term studies. That
Paul,
was
I'm sensing
long-winded.
it's time for a little sip of water there. I could see that you're struggling a little bit.
Yeah,
Paul, you mentioned a consumer that wants to be private, wants to be discreet, and how smoking a joint or a bong, you're releasing pretty strong evidence that most people can relate to and identify with. A very small thing, but if you are indeed that discreet um, person and you are just getting into this, and if for any reason you cannot invest into a vaporizer right away, and smoking a joint is really the only thing that you have available to you, again, a small thing, but we just want to point this out, is if you are actually consuming this in a fairly confined area, even when you walk out of that space, that odor will still be with you. Like it'll be in your hair, in your clothes, in your skin, perhaps even. So, just a little word of caution for those that are fairly new to this. And if that is very important to you, believe that this is valuable information. Although today, with deregulation, it seems to be more acceptable out there, less stigma associated with it, but it might still benefit someone who heard this.
for sure. The last thing that I would say, and we touched on when I introduced the vape pens or the cartridges, the high concentration stuff, they're not for novice users. And it's someone, we'll say, who's veteran, who's been at it for a little while, who has a very good idea of what their dose is and how they look to put that into their treatment plan. And someone who's just started or really new to it, using your Ferrari example, Mark, it's not the first car you want after you get your license.
Mm-hmm.
Start low and go slow, and that's why we would say work up to, if that's where you end up as the high concentration stuff. Start low though first.
Very good, Paul. Um, seems like a good wrap up. Anything else to add to that?
I think we're good today. I think that's as far as this is going to go.
Yeah, Paul. We exchange this between you and I and Doug when he's with us. But to put you on the spot right now, for our listeners, what topic can they expect for next Thursday?
Oh my, you did put me on the spot.
You know what?
Oh,
I will inform them in my later session today and tomorrow, and I do that throughout the week just to give them a heads up, Paul.
I'll be honest, I do know it, but I'm working on about two or three things right now, and I might say the wrong one.
It's all good. Yeah, for me, anyways. Paul, I appreciate the time again. I look forward to next week. So it's my turn to do my little wrap up and disclosure. Is I'd like to remind our audience that these information sessions are intended for individuals who are in generally good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment, including for mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent, does not cure or treat any mental disorders or medical disease. Further, these sessions are not a substitute for therapy, for counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those who have taken some steps in improving your quality of life, congratulations. Remember, your journey is your journey. And as long as you are taking some steps forward in improving your quality of life, you should be very proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Paul, myself, and those behind the scenes, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.